Hi, my name is Isabella Rodriguez, and I'm a student at Anderson High School. I am a senior, and I will be graduating May 2022. I took a class called Health Science Practicum, taught by Angela Zimwalt here at Anderson. Today I wanted to spend a little bit of time just talking about what my experience in this class was like. I shadowed at a vet clinic, specifically Far West Veterinary Clinic. I want to get into the real deep talk about the things that happen behind the walls of veterinary clinics, or what mine was like at least. So let's get straight into it. When I first arrived at Far West Veterinary Clinic, I was super nervous. This was a professional, well-established clinic, and I had no idea how to act. The worst part about it, I didn't know the slightest bit about veterinary medicine. I basically dived into a whole new world of healthcare, and to be honest, I was pretty scared. When it comes to humans, I do get anxious about caring for them. This is because there's a lot of responsibility put into being the one who is trusted with someone's health and sometimes their life. I felt the exact same way about animals, but nevertheless, I walked in with my head high and was prepared to learn. My first day being there was very hectic. I saw people running around, treating dogs, treating cats, doing surgeries. It seemed like it was such a busy environment that I had never been in before. But one thing that did happen was that there was a well-renowned doctor who was doing a surgery in the room next door. The surgery that he was doing was on a dog whose leg had gotten fractured as he had jumped onto the sofa. Here you can see an X-ray exam image of the canine's leg post-surgery. I was thankful that the doctor had let me take a picture of it. Here you can see that I've circled where the plate is. You can see how it fits with the rest of the bones. It was quite the experience, as you could probably expect, seeing a doctor drill in screws into a dog's tibia. Thankfully, I didn't feel sick or anything. I was afraid that I was going to. Though I do very distinctly remember that he had talked about something called the Halsted Principles. Halsted's Principles of Surgery are 7 rules or principles that are used in any kind of veterinary surgery setting. Surgeons are expected to follow these procedures during any kind of surgery. It originated from William Stewart Halsted. These principles include the following. Number 1 is gentle tissue handling. Essentially, this just means that you don't drill or cut into any excess tissue that doesn't need to be touched. You want to make sure that the smoother the procedure, the smoother the recovery. Number 2 is to practice meticulous hemostasis. This means to preserve the blood supply and eliminate any kind of excessive bleeding if possible. Number 3 is obliteration of dead space. As a vet, it is their job to practice many types of suturing. But basically, you're trying not to leave any kind of dead space, aka extra space, because you want to leave the body the way that you found it, so that everything just goes normally. Number 4 is to practice tissue apposition. This relates a lot to the obliteration of dead space, which we just talked about, but you want to make sure that you're not leaving any kind of tissues unsutured or leaving them kind of bruised, and make sure that you can get as much tissue in your suture as possible. Healing can really be one of the toughest parts of any kind of surgery or procedure, so it's always best to try to make sure that it is as painless and fast as possible. Number 5 is to practice avoiding any kind of tension during the surgery. Any unnecessary tension during a procedure can be really fatal for an animal. Although they are sedated and probably won't feel as much as you'd think, sometimes they can still get some kind of pain and reaction to go up to their brain. This can increase their heart rate, their pulse, and their respiration, which can unbalance everything during the procedure. Again, the whole point of these steps and principles are to avoid any excess pain that is unnecessary and can prevent healing from happening as fast as possible. Procedure number 6 is to practice careful aseptic techniques. This basically means that you just want to try to make everything as sterile and sanitary as possible. This ensures that the patient won't experience any kind of iatrogenic infections or diseases later. Iatrogenic basically just means any kind of disease or infection caused by a doctor. And number 7, last but not least, is the importance of rest. The best medicine that anyone can take is rest. As a vet, it is really important for you to mention to the owner that they should be practicing healthy healing procedures, like resting. It was really quite ironic that the doctor that I was shadowing had explained these principles to me, because when I went to my second period pathophysiology class the next day, we were talking about Halsted's principles. It was really funny because I had already kind of understood what they were about, simply because I was shadowing. So it went to go and show that this class that I was taking really was helping me. I was learning a lot, and I was getting some really great experiences out of it. Many people would think that being at a vet hospital wouldn't really give me the same experience as being at a human hospital would give me, but I would like to beg to differ. I'm actually very glad that I was able to go to a veterinary hospital instead of a human hospital, simply because I got so much more experience that I know I wouldn't have gotten in a human healthcare setting. The physical experience of getting to see what medicine is like in these kinds of settings really helped me to further advance my knowledge of medicine. Surprisingly, a lot of the medical side is very similar between animals and humans. It's more of the ethics side that does differ. Obviously, dogs don't talk, and people do. Obviously, humans don't bark, and dogs do. I'll just be talking a little bit more in detail about the differences and the similarities between human and animal medicine. As I mentioned before, one big difference is that animals cannot speak. Typically, they can only cry or whimper or bark. This is a huge difference between humans and animals because humans usually speak what's on their mind. If they complain about something, it's because they're in distress. And when a dog whimpers about something, sometimes we don't know exactly why they're whimpering about something. I'd like to also say that animals are typically a little more domesticated and therefore let veterinarians do what they need to for the most part. But this can also be affected vice versa, in the sense that sometimes animals can be a little bit more aggressive and not let anyone touch them. Sometimes animals will try to bite or scratch a veterinarian because they don't want to be touched. Obviously, a human biting a nurse is not very likely, but a human complaining to a nurse is pretty likely. It's the small similarities and differences like this that really affect everything. But one big similarity that they do have between animals and humans is the type of equipment and procedures that are done on both. For example, inserting a catheter, drawing blood, administering vaccines, almost all of these are exactly the same. The only slight difference between these two is typically the location of these procedures. For example, typically dogs get blood draws on their jugular vein, which is right here on their neck. And humans typically get a blood draw, which is done right here on their wrist. I'd also like to mention that surgery, anesthesia, and dental procedures typically are done the same way as they are done between humans and animals. Overall, I loved going to my site and seeing familiar faces who continued to make me feel included every single day and wanted to help me learn all there was to know about veterinary medicine. I am eternally grateful for them for making this experience a great one. If I could offer any kind of advice to underclassmen planning to enroll or already enrolled in health science practicum, it would just be to keep trying until you find that one site that you really feel comfortable in. There's always a perfect site for everyone, one where you'll feel like you're really learning and where you'll also feel really accepted. For me, this was Far West Veterinary Clinic. It might not always be the first site that you set your eyes on, but sometimes it might be. Whether it takes you 1 or 10 tries to find that perfect site, once you do find it and you feel like you're accomplishing something, it's one of the most irreplaceable, best feelings in the world. I would like to mention on a personal level that I used to do orchestra all throughout high school, and I was supposed to be enrolled to take it my senior year, but I did have to drop it in order to take health science practicum because the schedules did not align. So I would like to say that obviously I do miss being in orchestra and playing with the orchestra, but I'm really happy that I got to get this experience, and I know that it'll just help me in the future, so I don't regret anything. Sometimes you'll have to make some sacrifices like that to get things that will help you in life, but it's just good to always remember that things always help in the long run, and it's good to think about your future and how things are going to affect it. Thank you for listening.